345 cases of COVID-19, bringing our number diagnosed to 5,709. We're reporting that there have been an additional 36 deaths in this country, bringing the total of deaths to 210. 27 of the additional 36 are in the east, 6 in the north, 3 in the south. 17 are female, 19 are male, and the median age of these additional deaths is 81. And we've been informed that 24 of the 36 have an underlying condition. And again, I'd like to take the opportunity to express our condolences to the family and to the friends of each one of these individuals. Of the deaths, 210 that we have so far, 154 of those have occurred in a hospital setting, and that's 73%. 22 in intensive care, which is 10.5%. 162 have been reported to us as having an underlying condition, that's 77%. The male-female breakdown is approximately 2 to 1, 133 males, 77 females. The median age overall is 81, and the mean age, somebody was asking me for last night, is 79. The breakdown of cases to midnight and Sunday night, a total of 5,593, which also includes some of the cases I reported to you yesterday from Germany. Hospitalised 1,345 of those, which is 24%. 194 had been admitted to intensive care, that's 3.5%. They involved 270 clusters, accounting for 1,103 of those cases, and 25% of them, or 1,388, related to healthcare workers. And the median age of those cases was 48. Additional samples of the kind that I reported to you yesterday evening from Germany, 179 additional ones with 20 positive, positivity rate of 11%. And as I've said before, we'll continue to feed that into the modelling data and report it as part of our more detailed breakdown each day. In terms of intensive care, a breakdown of 205 cases ever admitted to intensive care. 138 of them are reported as currently in ICU. 45 have been discharged from intensive care. There have been 22 deaths, as I've said, in relation to intensive care admissions. Of intensive care admissions, 159 or 78% were reported to us as having an underlying condition, and the median age of those intensive care admissions is 61. There have been 119 clusters reported across nursing home and other residential settings, 72 of which are in the east, and 46 in a hospital setting of one kind or another. And the transmission information in relation to community transmission is that it now still accounts for about 2/3 of cases, or 67%. So I'm going to ask Cillian de Gascon to say a few words from the National Virus Reference Laboratory in relation to his services. Cillian.
Thanks, Tony. So just to give a little update on the numbers. So as of this day last week, we had done 30,213 tests. Today we're reporting the results of 42,484. So that's an increase of 12,271 over the course of the week. And I suppose our difficulties with testing have been well documented, but I think it's important to highlight that we are still testing at a significant rate, and that number of 12,271 is actually accounts for about 40% of all of the testing that we have done to date has been done in the last week, and that's across the country. And the positivity rate over the past week has been 19%. Which demonstrates that we continue to prioritise samples from hospitalised patients and from healthcare workers. Currently, we're at this point in the week, we're probably in the region of about 2,000 samples per day, and that will continue to increase over the coming weeks to our goal of 15,000 samples per day, which will allow us to perform real-time testing to facilitate our goal of identifying cases, isolating and contact tracing in real time. Thanks.
Okay, thank you, Cillian. So we're happy to take any questions you might have.
Okay, Zara King, Virgin Media News. Tony, I suppose it's obvious to a lot of us who are coming into the city centre today, there's an awful lot of people out and about. Perhaps it's people who have booked annual leave before all of this, so now they're not necessarily working from home. They're off and they seem to be getting out and about. I passed 2 parks on the way into town today, guards trying to clear people out of the parks. There's definitely more people out today than there was this day last week. Firstly, is that a concern to you? And secondly, having that conversation with some of the frontline healthcare workers, one said to me today, that we see in other countries that cases have doubled every 3 days. If that happens here, we will run out of fully staffed ICU beds very, very quickly. They say everyone needs to stay at home or Dublin could turn into Madrid in a matter of days. Is that a sentiment that you would echo, and what do you think of that?
I would share the concern that maybe we need to continue to see high levels of compliance with the measures that are in place. We've reported to you a number of deaths higher than any number that we've given to you previously. The disease is still here. It still represents a risk to the population. There is still transmission of this disease happening in a way that gives us concern. The epidemic is growing day on day, albeit at levels lower than it was in the earlier stages. But we're not at a point yet where we think that we're ready as a society to step back from the collective effort that we've had in place. And we can understand the effect that upcoming holidays and bank holiday weekends, good weather, and maybe a little bit of fatigue with some of the measures that are in place can have on the population. But I think our message is a clear one. We want people to stay the course with us. We think it's important that we continue to, as it were, double down on the measures that are in place to really ensure that we can get the most out of the restrictions that are in place in terms of the extent to which we can interrupt transmission of this virus. And as I've said before, that's about protecting individuals in the population. It's about, in particular, protecting vulnerable communities. And although it's a significant ask, we are still making that ask of people, and we continue to need cooperation from people. We did give consideration to this question today at our meeting of the National Public Health Emergency Team, and as part of our statement you can see a collective agreed statement in relation to this that is essentially capturing the sentiment that I've given you, that's recognising the good work that the Gardaí in particular have done in helping to ensure that that message gets across to people, and that we think it's important, and it will be important, for people to stay the course and to commit to a continuing implementation of the measures we have in place across society.
Do you think, we see there that 515 of the confirmed cases on sites in hospitals are in Dublin. Do you think Dublin needs stricter measures than the rest of the country?
That's a good question, but we think that the disease is growing at roughly similar rates, albeit at a different proportion. This is an epidemic that we've seen in this country where the majority, if you like, in terms of cases, and we see that in terms of the total number of cases, we see it in terms of clusters of infection in particular locations, we see it in terms of ICU admissions. It is centred on Dublin. That's not a pattern that is out of kilter with other large cities in other parts of Europe, but we think the disease is growing at roughly similar rates in all parts of the country. So we don't think that there would be justification in selectively focusing on Dublin. We think the measures that we have recommended in place are the right measures for the whole country, all at the same time.
Killian, can I just ask you really quickly in relation to the test numbers? Do you have an estimate or a rough guess of how many people are going untested, people maybe who mightn't have the most extreme symptoms, those who are being advised to just stay at home and self-isolate? Do you estimate that, or do you take that into consideration at any stage?
I don't have that figure.
I can give, and we'll give you more information on this, because I think I said to you last night that I expect that Professor Philip Nolan from the modelling team will be with us, if not tomorrow night, more likely Thursday night. And we have a good deal more information to share with you from the modelling work, both in terms of our description of the disease thus far and our sense of projection from here. I think I said last week in particular that we'd need to see as much time pass during this week to get to see that we've had, if you like, the most opportunity to get the most out of the measures that are already in place, so as to make those projections as reliable and as robust as they can be. And some of the modelling work that he will have done will have taken account of significant numbers of cases in the population that might not be identified for the kinds of reasons that you're identifying. Some of these cases of illness we know are very mild, and we know that there is asymptomatic infection of individuals. And some of the models that we will have and share with you will attempt to take account of those very factors. And
sorry, last one for me, because I know there's other people waiting. Just in relation to childcare for frontline healthcare workers, have we any update on that?
So we gave some further consideration to that, and there are some further meetings happening on a cross-government basis in relation to that issue. We understand the issue and the importance of protecting the workforces and essential workforces, and particularly in the healthcare arena, and we're looking to try and find a solution to that as quickly as we reasonably can. Thanks, Sarah.
Dr. Hoolan, I have a question for you. I think you know about this question. It's from Cora, who's aged 8 years of age. She's an 8-year-old girl, yes, from Tipperary, who I think sent you a card via RTE. She's asking, when is the zoo likely to be open again? She has her birthday coming up. And what can you say optimistically for people, both young, like Cora, and old, as to how long this is going to last?
So you sent on the card to us today, and thank you for that, and thank Zara for the card herself. The measures that we have in place, the best that I can say at this point is they won't be in place for any longer than they need to be. We're working as hard as we can to try to ensure that we get as much compliance as we can across the population with the measures that are in place, and that we can do as much to interrupt the transmission of this virus in the community, to slow down its progression, ultimately to get to a point where we can actually, as I've said before, to drive this infection out of the community, to focus then on, as we have been doing in the last week and 10 days in particular, on the institutional transmission that we see happening and that has happened in nursing home and other environments, to try to suppress this as much as we possibly can. When we think the time is right, but no sooner than that, we will recommend a lifting in terms of the measures, but only if we're satisfied that we think, first of all, that the disease is, as it were, behaving itself in the way that we want it to, and also that we have the measures in place in terms of testing capacity, in terms of sampling capacity, and in terms of contact tracing capacity to be able to very rapidly identify any increase in cases that would occur after that point.
And there was a study out of America today, not sure where the data came from, not sure how they reached their conclusions, but it seemed to suggest that Ireland may have reached its peak and that we could see 400 deaths and that would be it. Have you had a chance to see it?
I'm aware of it, and it simply isn't true.
Okay.
It's not reliable, but I might ask Dr. Glynn to say a little bit more to you. That's not something that people should either listen to or rely upon.
So yes, Fergal, from what we can tell, that model is, well, it's not really a model, to be honest. It just took existing case data and basically suggested that because things seem to have stabilised over a short number of days, that perhaps we've reached a peak. It doesn't take into account any change that might happen over the coming days. It doesn't take into account the fact that we're reporting the highest number of deaths to date this evening. As you're aware, we have the modelling group led by Philip Nolan. They're inputting and using a very more extensive range of parameters fitting into their model. And I think really people need to wait and see what comes out of that. And I think it's very important that people wouldn't take undue store from what was said in that work in America, because it would certainly lead to undue complacency at a time when we certainly can't afford that.
Thank you. Thanks, Fergal.
Hi, Tony. I know NPHET met today. Should we just say to the Irish people now that the restrictions that are in place will be there beyond April 12th and get rid of any sort of uncertainty about what happens on Easter Monday?
So I will try to be as honest and open as the week goes on about that. As I've said, and I said last night, look, it's not at this moment in time. We're not anticipating a recommendation later in the week that we should lift the measures that are in place. But we'll give further assessment of that as the week goes on. We do want to see what I would describe as the full benefit of the measures that were put in place, in particular towards the end of the week before last, the Friday measures that really restricted the amount of movement in the population, that limited us in terms of workplace participation to only essential workers, and so on. You're familiar with that full range of measures. We want to see the full benefit of that, which we think will take most of the remaining days of this week. So we think as we get closer to the end of the week, we'll be in a much better position to make that formal assessment ahead of the 12th. But at this moment in time, it doesn't look likely that we're going to be recommending a lifting of those restrictions for now.
What would have to happen then later this week for you to lift those restrictions?
So it's really two groups of criteria. So one is the group of criteria that relate to the disease and characteristics of the disease. It's to do as well as the growth rate in the number of cases, in the number of admissions to intensive care, in the number of deaths that we report, and other indicators of the disease. So we have a list of those criteria, and then there is also a list of measures, as I've said already, things that we need to have in place that give us assurance that in the event that we feel that the transmission of the disease is at a lower level, which is not what I'm anticipating by the end of this week, that we have the maximum chance of detecting those cases early and in real time, testing them early and in real time, and contact tracing them early and in real time. And that's what we have to have in place in order to allow us to lift and to recommend the lifting of measures. We will also be informed by anticipated advice that we have coming from the ECDC, the European Centre for Disease Control. As you know, about every week or so, or 10 days, has produced a new risk assessment, and we're anticipating a new risk assessment over the course of this week, which will also, if we have this before the end of the week, help to inform some of our assessment.
The number of people who've sadly died, it's 36, it was 16 yesterday, it's quite a jump. Does that give us any indication of how the virus is spreading through the country? Can we read into those figures to go from 16 to 36 in a day?
It looks like a big jump, but ultimately these numbers on a day and daily basis they're still relatively small. They are subject to that kind of variation on a day-by-day basis. And we look to the modelling work that we have over the course of the next couple of days to put that into a context and to see what this trajectory looks like. As I said, the trend that we're looking at is not just the trend in new cases each day, it is the trend in intensive care, it is the trend in terms of deaths. By how much is, according to each of those indicators, the disease growing on a day-by-day basis. And so it won't be any one of those, it'll be all of them taken together.
Right. And just finally, Cillian, if I could ask you, are we still saying to people then that shortly we're going to be conducting 15,000 tests a day?
Yes, I suppose it depends on your definition of shortly. That's a number of weeks away, but certainly over the next...
What's your definition of number then?
Good question. So I would think over the next 3 to 4 weeks, that's where we'll get to 15,000 tests a day. And that's across the whole system. So ourselves, the hospital labs, public health, and then our colleagues in agriculture as well. So no, as I said, it's interesting because from our perspective, the last sort of 7 to 10 days has been very difficult because we haven't been able to do the testing that we wanted to do. But as I mentioned at the start of the briefing, 40% of the testing that we've done in the country has been done in the last week. So it's all relative in many respects. So yeah, over the next, there's a lot of things happening over the next 7 to 10 days that will increase capacity substantially.
Hi guys, Paul Osford from the Irish Examiner. Tony, just a quick question in terms of, yesterday the Financial Times reported that a number of European countries have put together planning groups for exiting the crisis. Today we saw Denmark make announcements about staged reopenings of schools and of cinemas and hairdressers. When NPHET meets, is there a strand to it about what comes next, about easing these restrictions completely?
Yeah, so it will be, as I say, informed by those criteria. It'll also be informed by the advice that we have from the ECDC in relation to those measures. And I mean, one of the things that's characterised this infection in Europe has been that maybe at different points in time, different countries have moved on different measures. It hasn't all happened in lockstep. That can make sense at one level because the disease is at a different point because it spreads across Europe and it's not always in the same phase at the same time in every country. But there's also been a variation, if you like, between countries in the kinds of measures used and what's been deployed. And I expect to see at least some variation happening in terms of the kinds of measures that are relaxed or reduced in different countries. I think the ECDC and certainly with what we would like to see a situation where there's a kind of coherent and planned, if you like, in line with the evidence and the advice, set of measures in place to remove or relax those restrictions rather than something more, as it were, haphazard and ad hoc. So we'll be looking at their advice for that reason. We'll be looking at the disease criteria that we have, and we'll set out, I think, more formally towards the end of the week what we think the situation will be, because we have identified the 12th of April as the next step, if you like, and so we'll be well before the end of the week be in a situation to update on where we think we'll be. But I'm not anticipating at this point in time that we'll be recommending a change in the current level of restriction at that point.
Just in terms of the numbers then today, obviously people will be fairly, I suppose, fairly worried about the jump in the numbers. In terms of numbers people who've recovered, we still haven't really got any kind of data on that. Is there any update on that?
So we expect to be in a better position later in the week to give you some information on that, and to give you some more information on things like lengths of stay in hospital, lengths of stay in intensive care units and so on, which we haven't given you so far because we simply haven't had long enough in terms of intensive care admissions and numbers of discharges. Although you see, and you rightly say, the number of discharges from intensive care has increased. It was it's gone up as far as 45 now today of those who've been admitted to intensive care. So we see people are recovering and being discharged from intensive care, but we would like to be able to give you more comprehensive detail in relation to recovery, not just from intensive care, but from the disease, irrespective of where people are, whether they're in hospital or whether they're at home or elsewhere.
Great. Colin, just very quickly, we saw some issues over the weekend with PPE coming in and out of the country and the quality of it. Are we confident now in terms of the deliveries that have come in that situation is taken care of, that every healthcare worker in the country will have access to adequate and an adequate number of PPE units?
Well, there's unprecedented demand internationally for PPE. We've seen incredible stories of diversion of shipments and planes from one country to another, and they're very credible stories. So we're fortunate to have secured a supply line. We certainly want to keep what we have and use what we have, even if it's not the ideal PPE for our healthcare workers. We want to adapt it and categorise it as best as possible to keep our healthcare workers safe. But there is also unprecedented demand within the country, because we know now there's outbreaks within nursing homes and other settings that where there's a requirement for PPE, where previously there wouldn't have been a big demand for PPE. And part of our approach to this is not just to focus on PPE, but broader infection prevention and control measures within nursing homes. And our Professor Martin Cormagan has visited nursing homes. As I mentioned before, we provided video training for nursing homes. We're enhancing support to nursing homes in terms of training, not just in PPE, but also in distancing, in cocooning, in safe measures to reduce transmission of the virus. And as you know, the government has announced some financial support for nursing homes in order to help them to break that chain of transmission in what is a very vulnerable and fragile, if you like, healthcare setting. So in answer to your question, it remains a huge demand for a PPE within Ireland and internationally. We have to use what we have wisely, and we have to make sure it gets to the right people, be they in the community or the hospital, to keep them safe and prevent transmission of the virus.
Great, thanks.
Thank you.
Paul Cullen from the Irish Times. Were any decisions made today at the meeting? Any recommendations? Have they gone to government?
And not much in the way of recommendations that are at that level.
About measures or...
So for the most part, there are no additional measures in that sense, Paul, but there are some technical ones in terms of advice that we had from the expert advisory group around specific guidance that we will be conveying through the HPSC in the usual way, guidance in relation to a number of, if you like, aspects about the clinical and public health management of the disease. For the most part, we were discussing and reviewing, as we've done each time, the measures that are in place, the path and the course of the disease, and that was what we spent a lot of our time talking about. We don't have an additional set of new recommendations or measures to recommend to government for increasing the level of restriction that's already in place.
But you have another meeting later in the week?
We have another meeting on Friday, and I think I said last week that we'll be kind of formally then assessing the extent to which we think we're in a situation whereby we're either moving past the 12th of July or 12th of April with the same restrictions are in place or something else.
And Killian, can I ask you just a simple question? What is the backlog for people waiting for tests? What is the backlog for people waiting to have their tests processed?
So the backlog for people waiting to be sampled, I don't have that figure. The backlog for people waiting to have a test processed is the wait time now. So I don't have an exact figure, but the wait time certainly for people who aren't in one of the either hospitalised or healthcare workers is in the region of 7 to 10 days on average, I would estimate. We are prioritising cases from hospitals and healthcare workers because of the limitations on our capacity, and the turnaround time for those individuals is probably still in the region of 24 to 48 hours, I would imagine.
But Killian, you come here every week and you're asked this question and we never get an answer, to be honest with you.
Yeah, so that was the challenge is that there's a number of different steps in the process, and the figures coming into the system need to be put onto the laboratory information management system and then calculate on that basis and prioritise. And at the moment, we've people doing that work from a data entry perspective on a daily basis, and it does take time. There's a time lag between the samples coming into the lab and getting up onto the system in the region of 3 to 4 days, and then once they get up onto the system, there's a further delay before they're tested. And as I said, the capacity issue is where we are at the moment. It's going to ramp up in the coming weeks, but we don't have capacity at this stage to do the amount of testing that we want to do.
Paul, can I
Everyone-
just
Yeah.
come in there?
Colin.
Just answer to your question. We do now, since the case definition narrowed a number of weeks ago, we now, with our testing centres and the supply of swabs, we are now able to test the demand coming through, because the demand, excuse me, coming through with the wider case definition was much higher. It is now much smaller with the more focused case definition and the priority groups. So our testing centres are able to meet the demand coming through there, which is of the order of 2,500 or thereabouts per day, including those going through community and hospitals. The difficulty we had, as everybody knows, during the week was having those samples addressed at the level of the labs because of the shortage of reagent, and hence to improve the turnaround time, we engaged labs on mainland Europe to help that turnaround time, and we're confident that will be cleared within 5 or 6 days, and our turnaround time will be down to a much more acceptable level.
And when is ENFER coming on board?
End of the week, end of this week.
End of this week?
Yeah. So
And it's a much greater capacity, is it?
yeah, so they've been prepping samples for the last week and a half, and they took delivery of their first extractor there at the end of last week. So they're already extracting samples, and then the next step is just the PCR. So they're expecting delivery of a platform on Thursday and should be testing them by the weekend.
Was there some problem with the indemnity for the test being done there?
I don't think there was any problem. It was something that needed to be addressed.
It took a bit of time.
But yeah, absolutely. But my understanding is that that's all been sorted now.
And it's worth just pointing out, if I may, in addition to that, Paul, that like the purpose obviously of the growing is to give us a capacity in as we move forward, to being able to ensure, particularly as we've talked about the possibility of reducing some of the measures in place. If we find ourselves in that situation from a disease point of view, we really have to be able to turn around tests within on a real-time basis, and to build a capacity within our testing system to be able to do that. And so the focus of an expansion of testing now that's happening through ENFER and elsewhere is about giving us the capacity to do that, so that we are in a situation to test people in the community and to get a same day or next day result, and to contact trace people in that way, and to test those contacts in a real-time way as well. That's what we'll need to have in place, and that's what we'll need a capacity for. We're not at the point where we have that capacity in place now, but that's what we have to grow through as quickly as we possibly can.
Okay. I hear your criticisms of that US modelling, but at least they did produce a model. Nature abhors the vacuum. You've waited a long time to come out with the results of your own model. We did have a leaked number at the very start of the number of people who might get the disease at the very start of this crisis. We haven't heard anything yet. So, I mean, these exercises have their limitations, but people are looking for a route map.
Sure. So just a couple of things on that. So the figure that was mentioned at the beginning wasn't so much a leak as a projection that we would be at, which was correct. If we continued to grow at 33% from the number of cases that we had at the point in time that number was identified, we would have gotten to 15,000 by the end of the month. The fact that we didn't get there was because we managed to flatten the curve as a society. And we did that through the various measures that were introduced. And what we were clear about is that with the modelling work that we're doing, and it's being led, as Dr. Glynn has said, by Philip Nolan and a team of 50 mathematicians across the academic and university sector, it's a huge enterprise of activity. And the reason we haven't given a forward projection from that is because we don't believe that we've seen the point, and I said this clearly last week on a couple of occasions, the stability, if you like, in the model to allow us to project forward. In other words, we're continuing to see improvement in the reduction in the growth of this epidemic. So at the beginning, that figure of 15,000 came off a projected growth day on day of 33%, and that has been reduced steadily, and it's we believe, still continuing to fall. And the further it falls, the further into the future will come the point of peak, and the lower that peak will be. And we want to reduce that as much as we possibly can. And we think that it will take, at least tomorrow and the next. In other words, the further we go into this week to give that projection, the more stable and certain that projection is. And that's the reason that we could have given you a forward projection 2 or 3 weeks ago, but the confidence limits of that, in other words, the variation or the margin of error, as you might call it, would have been so great as to make that uninterpretable or useless information for the point of view of our action. And that's why I think correctly we've waited until we've had a good model, which we believe that we have, and an ability to see the full effect of the measures that are in place, which is at least 10 days post the last set of measures being put in place, to start to make any forward projection, which we will give you on Thursday of this week.
Okay, and just finally, I did ask before about an aspect of this modelling is about the economic impact, and when can we expect to see some figures there?
Quite honestly, I don't have an answer to that question, and you're absolutely right. The two aspects, one is the disease modelling, which I've just spoken about. The other is about work that ESRI and other colleagues are working with us on around the downstream economic and other effects. I just don't quite honestly have an answer for that question, and I'll get an answer for that question for you for tomorrow evening. Paul.
Good evening, Michelle Hennessy from the Journal.ie. Can I just clarify your answer there to Paul's question on the backlog? So am I understanding this right in saying that there isn't a backlog in the sampling, in the taking of swabs at the moment? Where the backlog exists is in the lab tests. People, can you maybe explain when people might get an appointment? If they say, if I call today, would I get an appointment for the following day or 2 days afterwards? But then I might not get my result back for up to 10 days. Is that the situation at the moment?
Just to go through it again, if I could briefly, is that as people know, we had to create this pathway from nothing over a few weeks ago, and we now have almost 50 sampling centres. We faced a shortage of swabbing equipment internationally, and that led to a slowdown in people getting the test to go to the lab in the first place. Those problems have been resolved through the establishment of these sampling centres, if you like, and through staff being redeployed to those sampling centres, and through us securing a steady supply of swabs in order to take the sample. And a further, if you like, difficulty we had was the reagent supply, again competing internationally, and a shortage of reagent, and other countries who didn't have a testing strategy at the outset now coming on board, trying to secure whatever spare stocks there were internationally, and that led to difficulties with our testing at lab level over the past week, hence leading to increased turnaround times. So we're confident now, based on the other suppliers we have on mainland Europe, that we're able to shorten those turnaround times down to a much more acceptable level, and clear those to have a seamless pathway from sampling or referral to sampling centre by GP, sampling at a sampling centre, right through to lab, and result within a much shorter time frame. It's taken a lot of work, but this whole pathway had to be set up without the normal constraints that we would have when we're setting up a service, which is to model it, to gauge it, to test demand, to pilot it. We didn't have the time to do that. We had to set up each component quickly, and we had to react to a rapidly changing case definition and rapidly changing information.
So how long is it taking now if you contact your GP to get an appointment for sampling?
Based on our sampling centres now, the numbers coming through since the case definition changed, there should be really no delays in getting access to a sampling
So it could be the following day?
It could be the following day or a couple of days. We give out, once it's entered by the GP through the health link, it's dispersed through the community healthcare organisations through the sampling centre. So it could take, and they give out their appointments 1 to 2 days in advance.
Okay. Just one final one from me. It was touched on yesterday, this phrase that we're in the top tier when it comes to numbers of testing. I know Paul Reid has previously said that we're in the top 5, and Ronan, yesterday when you addressed this, he said that when we give the numbers of tests today, we'll be able to assess precisely where we are vis-a-vis other countries. So where precisely are we now that we have the numbers?
So we've just given the number, and the number has just come through to us from midnight last night, so we need to go and look at that vis-a-vis other countries internationally. So I don't have our precise ranking at a point in time this evening, but we've given the number. It's a 40. We've done 40% of all our testing within the past 7 days, which demonstrates the difficulties notwithstanding the progress that we are making. And I'm happy to come back and answer that question for you tomorrow.
Tomorrow, maybe.
Yeah.
Okay, great. Thank you.
What is clear, if I can answer you, is if you look at the strategy internationally, it's not the same. From early on in this country, there's been a testing strategy, notwithstanding the difficulties we faced. And in other countries, there hasn't been the same focus on testing. And yet the WHO have been very clear that this is a significant linchpin in the battle against COVID-19 is testing.
ceist a scoilige de Colm Henry sin an ceist hiarna na réide an muil seo seacht go dé lá froseil tastalachas na sihir linnear fud na jíre. Cin chúise tal sin?
Well, tá brúnumar in chédal sios bhfuil mil chur ar réon daine bhfuil ag fanat leis an testáil seo agus tá míid chur fiabhsúrin scéalanis, bhí coscanna éagsile ar fád an toras hills go hamláin agus anis tá sé réite agin maidir leis an testáil dús beire agus tá siran sa bhreis aimse agin inis ní bháin in éiring ag th leabhar fosta, so tá súlagam agus tá dóchasach go jocí bhéiteach ar an scéal go luath.
Agus dúirte tíiseach ní slúthe ar Twitter, bhí sé gachaní ar gine ganna gáil a taisteal an deirí seachtain seo an teachtain siad seo. Go dé dear a hain faoi sin an grúpa sláint.
Gan dul taisteal?
Títhe siad.
Gan áras mar dúra cheanna, tá sé hadbheith táach mé dine clí leis na moltaí atá léiríagin ar fadalánis agus tá hadbheith táach go méid ahan duine is cuma ceacha a bhfuil tíos teachsír aige nó eici nó nachhfuil teachsír eici go clíonn si go dagan leis na moltaí má tá sé scrite. Muna chlíonn si leis na moltaí sin tá ahan seans go joci ardú mór ar líon na nochras na hospidal, ar líon na daine ar bás agus ar an brú a tar na hospidal cena féin.
Hi, Neil Leslie from the Mirror. I just wanted to just clarify or check, would it be fair to characterise what you're saying in terms of you want a sufficient level of testing regime in place before any easing of any restrictions would be allowed? Is that the same thing as saying we would have to have the 15,000 tests a day in place? That is the target, which we've been told would be about 3 to 4 weeks. Are those two things pretty much directly linked?
So in broad terms, yes. But like what the focus for us will be at the scale that we need to have it is having a turnaround quickly, so that we're not in a situation whereby we're waiting for a test result from the point of testing any longer than either same day or following day. That's what would be necessary for if you like the responsiveness of our public health system, so that we're able to sample and test. So the sample being the taking of the swab, the test being its analysis in the lab on same day or next day, because some samples may not get into the laboratory, for example, in time for running again. So you have a result on the same day or the next day. A delay of 3 or 5 days in terms of those results in a context where we've eased restrictions and we're really trying to rapidly case find and detect cases as soon as they arise simply wouldn't be good enough, and that's what our growth capacity is. We'll also be using, you've heard us talk about case definitions, a case definition which is really responsive and allowing us to pick up to really not miss any cases that might be occurring in the community. That's what we'll be trying to do, and that's what we need our scale and our capacity for.
But the figure of 15,000 would be kind of part of that then. You'd have to have reached that before easing restrictions is kind of what I'm trying to clarify in my
forgive me now, but I'm having a tiny little bit of difficulty in hearing you.
Sorry, I'm just trying to clarify, is that fair to characterise that until we hit the 15,000 a day, you wouldn't be able to ease restrictions? I'm not going to
put a specific number on that, but like, and I'm not also going to say that some static magic number that if we get to that, we've got as far as we need to get to, and we don't need to scale up any more than that. We'll have to be responsive on an ongoing basis. If we discover that our turnaround times are not where they need to be, we'll have to continue to grow our capacity. We're confident that we have, let's say, arrangements and plans in place now with the HSE to get us to that point.
Okay.
Just to go in on that number again, the important focus here is not so much on the number, but on the response time. And we're absolutely at one on this, that we need to have a system in place where we can refer someone for testing, and we can test, and we can then initiate the contact tracing in a timely manner that, if you like, hunts down the virus if the social restrictions are eased at all. So the number might be misleading in a sense, because people might think if you reach that number, then all is fine. It's not. It's the rapidity at which the contact tracing is triggered and the correct actions are pursued and stop transmission of the virus. So it's when I understand the focus on numbers, it's the process that's actually important and the timeliness of the process.
Okay. And just a separate thing on the compliance, I guess, with the Easter appeal and the good weather and so forth. It's a traditional time that people are turning to DIY experts. I see a lot of anecdotal stuff, people wondering why they can't access maybe online access to DIY and gardening stores and that type of thing. Is that something you think might help with the compliance measures, or do you have a view?
We have a range of measures in place, and we think they're the right set of measures. We've identified as part of that and working with partners across government what we think essential and non-essential services are for this period of time that we're in at the moment, which is a very restricted range of both social and societal activities and movement of the population, to really try to do our best as a country, as a society, to interrupt transmission of the virus. And we think we've identified, if you like, the right set of measures in terms of locations of businesses and so on, that we identify as either essential or non-essential. And we understand that these are times of the year when things like this happen, and I imagine that a lot of that kind of work can and will happen over the course of the weekend for people around their individual houses. But we don't think it's the right time for us to start to turn on, if you like, specific retail activity within that sector of the kind that you identify. We think what we'll be asking is for people to stick with us and to stick with the measures that are in place. We know it's a challenge on individuals, on families, on society, and we know obviously it's a significant challenge on the economy, but we think that it's a justifiable set of measures given the objective to reduce the transmission of an infection which is still identified, an additional, for us, sadly, 36 deaths today, and a continuing number of admissions to intensive care. So we're not in a situation yet where we think we can be starting to think about the specific relaxation of specific measures that have already been put in place.
Okay, thanks.